So hello and welcome to our webinar on hepatitis B vaccines. My name is Jennifer Boniface and I am one of the registered nurses with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects for the Medicare Preventive Services of hepatitis B vaccines and their administration. And just please note that this webinar presents the most up-to-date rules and regulations regarding hepatitis B vaccinations as of today. However, this information is subject to change. To stay current, please refer to the most recent updates published by the Advisory Committee on Immunization Practices, as those take precedence over any content presented today. The ACIP recommendations are available on the Centers for Disease Control and Prevention's website under vaccine-specific recommendations, and a link to this has been placed on the resources slide at the end of the presentation. Vaccination is one of the most effective tools we have in clinical practice to protect patients from serious, potentially life-threatening illnesses. For older adults and individuals with certain underlying medical conditions, preventive care is especially critical. Medicare Part B plays a key role in this effort by covering specific vaccines that can help reduce the risk of infections that might otherwise lead to significant complications. Understanding which vaccines are covered and ensuring proper administration are essential for both patient safety and adherence to preventive care guidelines. Today, we'll focus on the hepatitis B vaccine, which protects against a virus that can cause serious long-term liver problems, including cirrhosis and liver cancer. Our objective for today is to provide an overview of the clinical aspects for the Medicare Preventive Services of hepatitis B vaccines and their administration. During today's webinar, we will discuss background information about hepatitis B virus, different types of hepatitis B vaccines, and the Medicare Part B coverage criteria for hepatitis B vaccines and their administration. Let's begin by reviewing some facts and statistics about hepatitis B. Hepatitis B is one of the leading causes of chronic liver infection worldwide. Currently, an estimated 254 million people around the globe are living with chronic hepatitis B, with approximately 1.2 million new infections occurring each year. Here in the United States, up to 2.4 million people are estimated to have hepatitis B. According to the Centers for Disease Control and Prevention, about 640,000 adults are living with chronic hepatitis B, and almost half of them don't even know that they are infected. Per the CDC's 2023 Viral Hepatitis Surveillance Report, 48% of acute hepatitis B cases occurred among people aged 40 to 59. In 2023, there were 2,214 reported acute cases, an estimated 14,400 new infections, 17,650 reported chronic cases, and 1,000. Sorry, my screen just locked up on me. I apologize for that. Now that we've covered some facts about hepatitis B, let's take a closer look at the virus itself. Hepatitis B is a viral infection of the liver caused by the hepatitis B virus, or HBV. It is spread through blood or other bodily fluids from infected people. Because of this, people who may come in contact with infected blood or contaminated body fluids are at the highest risk of contracting the virus. There are two types of HPV infections, acute and chronic. An acute infection is short-term and usually resolves within 6 months. Chronic hepatitis B, on the other hand, lasts longer than 6 months because the immune system isn't able to clear the virus. This ongoing infection can cause inflammation in the liver, which can lead to a variety of complications over time. For more detailed explanation of HPV, you can watch our encore presentation titled Hepatitis B and C Screenings Clinical, and a link to this recording has been placed on the resources slide at the end of the presentation. Getting vaccinated is one of the most effective methods for preventing hepatitis B. However, it's important to understand that there is currently no cure for people who are already infected. Fortunately, most people who receive the hepatitis B vaccine develop lifelong immunity. The CDC recommends the hepatitis B vaccine for all infants, unvaccinated children under 19 years of age, adults 19 through 59 years old, and adults aged 60 and older with risk factors for hepatitis B. These recommendations are based on guidance from the Advisory Committee on Immunization Practices. Next, let's take a look at the different hepatitis B vaccines. For today's webinar, we will focus on recommendations for adults only. In the United States, we have several FDA-approved vaccines that protect against hepatitis B. Depending on the specific formulation, the series is usually given as either 2 doses spaced 1 month apart or 3 to 4 doses spread out over 6 months. Hepatitis B vaccines are categorized into 2 types: Hep B only vaccines and combination vaccines. Today, we'll focus on the Hep B only vaccines, since these are the ones currently covered under Medicare Part B's preventive services for hepatitis B shot and administration. Hep B only vaccines are a type of recombinant vaccine, meaning they're made using recombinant DNA technology. Scientists insert a small piece of the hepatitis B virus's genetic material into yeast or other cells. These cells then produce the hepatitis B surface antigen, which is the protein used in the vaccine. When this antigen is introduced into the body, it trains the immune system to recognize and fight the hepatitis B virus without exposing the person to the actual virus. The first FDA-approved Hep B only vaccine we will discuss is Injirix IB. Injirix IB, Injirix B. Injirix B is a single antigen hepatitis B vaccine. It is recommended for adults aged 20 and older, including adults on hemodialysis and those with immunocompromising conditions. For most adults, it's administered as a 3-dose series at 0, 1, and 6 months. However, for adults on hemodialysis and those aged 20 and older with an immunocompromising condition, a 4-dose series is recommended at 0, 1, 2, and 6 months. Additionally, these groups should receive a higher dose of 2 milliliters instead of the standard 1 milliliter. This may be administered as either 2 separate 1 milliliter injections or as a single 2 milliliter injection. The next vaccine is Hepatitis B. Hepatitis B is a single antigen hepatitis B vaccine recommended for adults aged 18 and older, including those aged 20 or older with immunocompromising conditions. The vaccine is administered as a 2-dose series with doses at 0 and 1 month. The last FDA-approved Hep B only vaccine we will discuss is Recombavax HB. Recombavax HB is a single antigen hepatitis B vaccine recommended for adults aged 20 and older, including those on pre-dialysis and dialysis therapy and those with an immunocompromising condition. The vaccine is administered as a 3-dose series at 0, 1, and 6 months. For adults on dialysis or those who are immunocompromised, there is a special dialysis formulation, and it is also given at 0, 1, and 6 months as a 3-dose series. Patients on dialysis should receive either Injirix B or Recombavax HB. Booster dose of the hepatitis B vaccine may be recommended for individuals whose antibody levels decline over time, such as patients on dialysis or those with immunocompromising conditions. However, for people with a healthy immune system who have completed the full hepatitis B vaccination series, routine boosters are usually unnecessary because the immune system remembers the virus and can respond effectively if exposed. And you can find specific dosing schedules for these vaccines in the hepatitis B section of the CDC's adult immunization schedule. It includes guidance for both routine vaccinations and for individuals with special health considerations. And I've included a link to the immunization schedule at the bottom of the slide for your reference. When discussing vaccines, it's important to understand that some side effects can occur. Many people experience mild reactions such as soreness, redness, tenderness, or swelling at the injection site. Some may also notice headaches, muscle aches or joint pain, fever, chills, fatigue, loss of appetite, or even fainting shortly after getting the shot. These reactions are usually mild and short-lived. However, in rare cases, a severe allergic reaction can occur. This can involve symptoms such as hives, swelling of the face or throat, difficulty breathing, a rapid heartbeat, dizziness, or overall weakness. If any of these serious symptoms appear, it is crucial to seek emergency medical care immediately. Finally, healthcare providers are advised to document and report all adverse reactions through the Vaccine Adverse Event Reporting System to promote continued vaccine safety. Now, let's turn our attention to hepatitis B vaccination coverage. Medicare covers the hepatitis B vaccine and its administration for patients at immediate or high risk of contracting hepatitis B. This includes individuals who haven't completed the vaccination series or whose vaccination history is unknown. According to 42 CFR Section 410.63, individuals at immediate or high risk fall into two main categories. The immediate group includes staff in institutions for individuals with intellectual disabilities, as well as classroom employees who work with this population, workers in healthcare professions who have frequent contact with blood or blood-derived bodily fluids during routine work, heterosexually active individuals with multiple sexual partners, specifically Medicare beneficiaries who've had at least two documented instances of sexually transmitted diseases in the past 5 years, and individuals who have not previously received a completed hepatitis B vaccination series or whose previous vaccination history is unknown. The high-risk group includes end-stage renal disease patients, hemophiliacs who receive factor VIII or IX concentrates, clients of institutions for individuals with intellectual disabilities, people who live in the same household as a hepatitis B carrier, men who have sex with men, illicit injectable drug users, Pacific Islanders living on Pacific Island under U.S. jurisdiction, excluding residents of Hawaii, and individuals diagnosed with diabetes. It's important to note that people who already meet the criteria for either immediate or high-risk groups, but already have laboratory evidence of hepatitis B antibodies are not considered part of these risk groups. Similarly, patients who currently test positive for hepatitis B antibodies are not eligible to receive this preventive service benefit. Patients may receive 2, 3, or 4 doses of the hepatitis B vaccine, depending on the specific vaccine used and their medical condition. There is no copayment, coinsurance, or deductible for this vaccine as long as the healthcare provider accepts assignment. The vaccine can be administered in a variety of Medicare enrolled clinical settings, including physician offices, outpatient clinics, hospital outpatient departments, federally qualified health centers, and rural health clinics. It may also be administered in community-based settings such as Medicare enrolled pharmacies, public health clinics, and mass immunization sites. For individuals requiring care in non-traditional settings, Medicare permits vaccine administration in places such as private residences, temporary accommodations, and assisted living facilities when furnished by a Medicare enrolled provider. When billing for hepatitis B vaccines, it's important to use the correct CPT and HCPCS codes, as these codes ensure accurate processing and reimbursement. The code you see on this slide should be used when submitting claims for hepatitis B vaccines. Now let's discuss the required diagnosis code. According to the Hepatitis B shot and administration section of the MLN 006559 Medicare Preventive Services chart, providers should use ICD-10 code Z23, which represents an encounter for immunization. Be sure to include this code on every claim submitted for a hepatitis B vaccination. For more in-depth guidance on coding of hepatitis B vaccines and their administration, please watch our encore presentation titled Preventive Services Hepatitis, and a link to this presentation can be found on the resources slide at the end of this presentation. Now let's discuss the use of modifier 25 and its role when administering the hepatitis B vaccine. Modifier 25 is used when a patient comes in for a vaccine and also receives a separate unrelated service during the same visit. In this situation, you would add modifier 25 to the evaluation and management service. It's important that the E&M service is clearly separate and distinct from the vaccine visit, with documentation reflecting both services. This lets Medicare know that the E&M service was significant on its own, not just part of the vaccine visit. On the other hand, if the only reason the patient came in for the visit was for vaccine administration, then modifier 25 doesn't apply. Finally, let's talk about the administration of the hepatitis B vaccine during an initial preventive physical exam or annual wellness visit. Vaccines covered under Medicare Part B, including pneumococcal, influenza, COVID-19, and hepatitis B, can be administered during an annual wellness visit or an initial preventive physical exam. This allows the patient to conveniently receive recommended vaccinations at the same time as these crucial preventive visits. It's important to note, however, that the vaccines and their administration are not included as part of the wellness visit itself. Each vaccine must be billed separately with the correct Medicare billing codes and cannot be charged under the AWV or IPPE. This means that even when a patient comes in and receives a vaccine during the same visit as an AWV or IPPE, providers must submit a separate claim for the vaccine and its administration. This ensures proper reimbursement and compliance with Medicare regulations. When documenting the hepatitis B vaccine and its administration, it's essential to record all important details about the vaccine. This includes date the service was provided, the name of the vaccine, the manufacturer and lot number, the site of administration, the dosage, the route of administration, and the name and credentials of the person administering the vaccine. In addition, documentation should support that the patient meets the Medicare Part B coverage criteria for hepatitis B vaccination, including evidence of risk factors that may place the patient in immediate or high risk category. Additionally, do not forget to provide education and document that the education was provided to the patient if it is. Under Medicare Part B, a physician's order is no longer required to administer the hepatitis B vaccine. This allows mass immunizers to use roster billing for its administration. Be sure all documentation is properly dated and signed with the provider's credentials. CMS reimburses rural health clinics and federally qualified health centers at 100% of reasonable cost for hepatitis B vaccines and their administration. For RHCs, these vaccine and administration costs are excluded from the calculation of the all-inclusive rate and are not subject to payment limits. Similarly, for FQHCs, these costs are excluded from the FQHC prospective payment system. RHCs and FQHCs may bill for all four Medicare Part B preventive vaccines along with their administration at the time of the service, even if no qualifying visit occurs. In addition, RHCs and FQHCs may bill HCPCS code M0201 for administering hepatitis B vaccines during home visits, as long as those visits meet federal requirements, in-home services, and preventive vaccine administration. Payments collected at the time of the service must be reconciled annually to the facility's cost report to reflect the actual cost of vaccines, their administration, and any additional costs associated with in-home services. RHCs and FQHCs are reimbursed at 100% of reasonable costs through the cost reporting process, and patient coinsurance and deductibles are waived for these preventive vaccines. Medicare provides an additional payment for administering Part B preventive vaccines, such as the hepatitis B vaccine, in certain patients' homes. This includes patients that are unable to leave their homes due to a medical condition that prevents them from leaving home without assistance, such as using a supportive device or requiring help from a paid or unpaid caregiver, being at higher risk for contracting disease if they leave their home, requiring considerable and taxing effort to leave the home, having a disability, or having a clinical, socioeconomic, or geographic barrier to receiving the vaccination outside their homes. Qualifying residences that are considered a Medicare patient's home include a private residence, temporary lodging, for example, a hotel or motel, campground, hostel or homeless shelter, an apartment in an apartment complex, or unit in an assisted living facility, group home, or non-Medicaid nursing facility, communal spaces in a multi-unit or communal living arrangement, and assisted living facilities participating in the CDC's Pharmacy Partnership for Long-Term Care program, or when resident vaccinations are provided through this program. Some settings are not classified as a patient's home and therefore do not qualify for the additional payment amount. These include hospitals, as well as Medicare skilled nursing facilities and Medicaid nursing facilities, even when a patient lives there permanently. Healthcare providers should clearly document the patient's reasons or barriers that prevent them from receiving vaccinations outside the home. However, certification of homebound status is not required for a patient to qualify for in-home vaccine administration. Medicare provides the additional in-home payment only when the visit is exclusively for administering one or more Part B preventive vaccines. If any other Medicare coverage service is delivered in the home on the same day, the additional in-home payment will not apply. In those situations, Medicare will pay the standard administration fee. These, the additional payment amount for in-home Part B preventive vaccine administration is geographically adjusted based on where the service is provided and is updated each year to reflect changes in administration costs. When hepatitis B vaccines are given to more than one Medicare patient in the same home or communal living setting on the same day, Medicare reimburses the standard administration fee for each vaccination. However, the additional in-home payment is made only once per patient per date of service, no matter how many Part B preventive vaccines they receive. Additionally, Medicare will pay the additional in-home fee for up to 5 vaccine administrations per group living location per day, but only if fewer than 10 Medicare beneficiaries are vaccinated at that location on that day. If 10 or more beneficiaries are vaccinated at the same group living location on the same day, the additional payment amount is restricted to one per home or communal space. And for more information, please refer to CMS's in-home vaccine administration additional payment. A link to this can be found on the resources slide at the end of the presentation. Hepatitis B vaccines help protect Medicare beneficiaries who are at immediate or high risk of infection from serious and potentially debilitating hepatitis B related diseases. These vaccines are covered under Medicare Part B as part of the Preventive Services benefits, making them accessible to those who need them. When speaking with patients, be sure to explain the benefits of this vaccination and encourage eligible individuals to include it as part of the comprehensive preventive healthcare plan. And so as a review, during today's webinar, we provided background information about hepatitis B, explored different types of hepatitis B vaccines, and reviewed the Medicare Part B coverage criteria for hepatitis B vaccines and their administration. On the next 2 slides, I've included some resources with links to important information we covered today. On this slide, you'll find resources from the CMS website. These include the Medicare Benefit Policy Manual, Chapter 15, Section 50.4.4.2a, the Hepatitis B Shot and Administration section within the MLN 006559 Medicare Preventive Services chart, details on the additional payment for in-home vaccine administration, and information on hepatitis B roster billing. On this next slide, you'll find links to several additional resources, including a WPS article on roster billing, the CDC's vaccine-specific recommendations, the Encore presentation on hepatitis B and C screening, and the Encore presentation covering the billing aspects of hepatitis B vaccines. Please use these slides as a reference as you review the material from today's presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions into the chat. And I'm looking at the chat right now, and I do not see any questions, but if you do have a question, feel free to put it in there and we'll address it before we wrap up this webinar. So please take a moment to complete the survey and share your feedback. Use your feedback to develop topics for future education events. You can access the survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. And again, that CMS Qualtrics page looks like this with that little yellow triangle. In a few minutes, you'll receive an email thanking you for attending, which includes your certificate of achievement and a link to the survey. If you need contact hours for continuing education, they will also be in this email. If you don't see it, check your spam folder. If you called in, email us at wps.gha.education@wpsic.com with the webinar name and phone number, and we will email you your Certificate of Achievement. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education at wpsic.com and put the title of this webinar in the subject line. However, if you have claim-specific questions, please direct those questions to our customer service department, as we don't have access to your claim information and therefore unable to look up claims. Also remember, we cannot accept any type of PHI or PII via email. And again, I want to reiterate that you do have 7 days from today to submit them. Finally, on behalf of myself, Leanne, and all of Provider Outreach and Education, thank you for attending today's webinar on hepatitis B vaccines. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.